Good evening. We have with us Dr. Chandan Biswas from the critical care specialist from AMRI Manipur, Dagoria, Kolkata. We welcome you to the Natco Pharma Specialty Criticon studio, and we look forward to listening to you for advice to the younger generation of doctors in the space of critical care, and especially with those in bacterial resistance. What is the changes that you foresee in the critical care management space?
See, what I believe is that in critical care management, like the kind of resistant bugs that we are dealing with nowadays, because we all work in the tertiary care hospital, so majority of the patients that we get are from different setups. So they are already exposed to a lot of antimicrobials. Even nowadays, the use of antimicrobials has been there in many, like those who do our domiciliary practice also, they even give antibiotics. So the bugs we get, they are very resistant variety. So what I believe is that you should always, whenever you are first starting on with the antibiotics, you should start with an empirical therapy, considering with the fact that the resistance can be there. And definitely, as soon as you get the culture reports, you come down with the de-escalation as far which is possible, so that we can look forward to a resistance-free future. That's what I believe.
Um, with you in the practice, and I would like to understand what message you would want to give out to the young doctors in ICU for enhancing patient care.
What I believe is that your focus and dedication, that's very important. Like there is no definite protocol in critical care. Like what I believe, you follow the guidelines, but whatever be it, you should also be individualized for each particular patient. You see what are the necessities, what the patient requires, and accordingly. Because what I believe, the guidelines that we get from the Western world, they deal with bugs which are not very resistant, but we are more working with bugs which are gram negatives, which are more resistant variety. So all the guidelines of the West might not strictly adhere to what we are practicing over here. But anyways, you have to individualize with each patient. You do your clinical rounds properly. You go through your reports very diligently and accordingly you follow up. That's what I believe.
Great. What is the prevalence of carbapenemus producing bacteria in your practice, and what is the treatment options you look at?
See, it's very high, in fact, as we all has been, as I told you, like we work in a setup where we are getting many referrals from different centers. So definitely the resistance, if we say in percentage, around 60, 70 would be resistant, especially with Klebsiella that we are getting these days. They are all having multiple resistance, carbapenem, and even we are giving many who are having even the NDMs are also positive. So obviously we need to keep that in mind. That is the kind of bugs that we're dealing with. E. coli also is very notorious nowadays, lot of resistance that we are getting. So what I believe is that it's around 60, 70% on an average that I would say that are resistant.
Dr. Chandan, we thank you so much for your time in the studio. We wish you all the best in your practice. And once again, thank you for sharing these valuable insights to the doctors of the future.